To our guided review of Chapter 10, Exercise 2, Week 1, and we're all about decontamination, sterilization, and disinfection. In this video, I will help you think critically about each question and guide you in making meaningful connections between the textbook content and your future responsibilities in the sterile processing cycle. But this is important. Please use your resources, especially your book, The Fuller, 8th edition. I want you to respond to each question using clear, complete sentences to receive full credit, and most importantly, deepen your understanding. Now, let's get started. Our first question is, before the washer sterilizer cycle is finished, the instruments are considered blank. Why is the final stage of decontamination important? I want you to think about what stage the instruments are in before they are officially sterile. How does that affect staff safety? What roles does the final rinse or lubrication play in the condition of surgical instruments? And how might these steps prevent errors during surgery or equipment malfunction? Here's our next question. Now, after the instruments are taken to the clean assembly area, what steps are performed next? Consider what needs to happen before any surgical instrument can return to the field. What should you be inspecting for? Why does a standardized tray setup even matter? Also, how does tracking or logging instruments contribute to accountability and patient safety? Now, for our next one, items with a lumen should have a small amount of what flushed through them immediately before sterilization. I want you to think about, why is flushing lumen items such an important detail? What happens if air is trapped inside? I want you to think about how pressure, moisture, and airflow affect sterilization, and what tools like suction tips or stylets might require extra attention. Now, great work working through these questions, but don't stop here. Go back, revisit Chapter 10 in your Fuller textbook, your course material, just to reinforce what you've learned. These details aren't just academic, they're practical, safety critical, and part of your responsibility as a surgical technologist. Remember, this journey is about becoming not just technically capable, but thoughtful, prepared, and professional.